It's excellent to be able to use something that's evidence-based so you can rely on it. NCQA recognizes it, so it's the foundation for a lot of our programs. It's just been great. Most recently, I used it to help with the creation of a behavioral health texting program. You can use the assessments to come up with questions you might want to ask patients, and then look at the education materials to think of topics that you want to address in this text messaging program. We also had an internal team with our leadership, lead social worker, and some RNs to help, really round out the development team so we could think about it from all kinds of angles and review the content, decide what we were going to talk about, what some possible responses would be. We started asking the food insecurity questions 3 to 4 years ago, and we started actually asking via text messages. So we started incorporating that into all the curriculum of our 15 text messaging programs. So that way we can document it in the chart so we know the patient's been asked, and then we can follow up when patients are identifying as with food insecurity. During the pandemic, it was excellent that we had a program up and running because there were many people with food insecurity during that time, and we received a donation from the Sharp Healthcare Foundation where we were able to give people food gift cards, just $100, but at least it's something, who identify as having food insecurity, in addition to sending them local resources on where to go if they end up having food insecurity again. There's lots of food banks and such in San Diego, lots of programs to offer, but at least we were able to send them a gift card as well to get them started while they're, finding out what resources were available to them. I wish I knew the amount of money we gave away in food cards, but it was spectacular. And that money lasted about a year, I would say. And now we still follow up. So people identify, we get anywhere from 50 to 100, positive responses in a month. We send them to a team of community health workers that assess the patient and send them resources as needed, whatever, because some stuff's available in different parts of town, right? So it kind of depends on the patient. So we'll follow up with them and fit what's ever best for their needs. And that's one way we use the assessments and education materials too, is just as a resource in order to think about what kind of questions you want to ask and what topics you want to address with patients, and leverage the resources you already have in place. Because as this person's waiting for behavioral health care, there's still some things they can work on. And if they're interested in working on them, that perhaps helps their anxiety and depression as well, right? So there's several things we can refer them to. So we'll ask questions about, medication. Do you know what medication you have, how you take it, side effects, etc. So we can refer them to our pharmacy benefits team and talk to a pharmacist. Or if they have questions about nutrition or managing their diabetes, we can send them over to a health educator or a nutritionist. So it's been an excellent way to leverage our existing programs and match them with patients' needs. So it's a new referral source, really, and it's giving patients something they can work on while they wait for therapy.